but then the eye manifestation of these systemic diseases. So I'll just wait so that once it's up, then we can go on. Thinking maybe to save time, while it is coming up, I can begin the preliminaries, and then we will go on. So the topic is systemic diseases with eye manifestation, early detection and treatment. I'm going to be talking to people who are my teachers here. I have seen a number of them. So I'm going to be working on tight ropes here. But I'm in a very good place because I count myself, first of all, a child of God. So we all are God's children. Now, we will want to first of all understand this. How can we detect these systemic diseases early? I want to first of all say that I know this would be like a mixed group. If you were to talk to, say, people who are doctors, there will be some kind of medical language you will use that they will be able to flow. In fact, even among health workers, you would still need to be careful if it is still a mixed group of health workers. What more of? Maybe we have people here who are not health workers. So I will try to use, again, common language, something that will be simple for us to follow. But I am not in any way demeaning or degrading your status, because I want to say that all of us are experts. And when a patient goes to hospital, the best way to approach it is to approach it as an expert-expert interaction. That the doctor is an expert in offering treatment, but that the patient is an expert in what he or she is feeling. So if somebody says, I'm feeling something moving, he's the expert. He's telling you how he's feeling. And it's not right to now make light of it and just throw it away. So we are all experts, and we should not look down on each other like, this professor who entered a boat to cross a river. And so he thought he was the expert and nobody else. And so he was talking to the canoe man and was saying, young man, do you know anatomy? And the man said, no, sir. So the prof said, 15% of your life is gone. Do you know geography? And the boy said, no, sir. Say, another 10% of your life is gone. Do you know further mathematics? No, sir. 15%. So he did that. When they were in the middle of the river, then the boat capsized. And he was clutching to whatever was floating. And the canoeman now asked the prof, do you know how to swim? And prof said, I don't. So the man said, the whole of your life is gone. So we all are experts, and we shouldn't look down on anyone. And so we want to look at what these multisystemic diseases are. So if you could go to the slide on multisystemic diseases. So the way God organizes our bodies, he organizes them in such a way that you have a very tiny unit, just like you stand as an individual. But then you are a couple, and then you are a family, and then you are a clan, and then you are, like that. It keeps growing. So the same thing too, from the tiniest unit of life, which is the cell, God has organized our bodies in structures called organs. So, for instance, this is an organ to smell. This is an organ for seeing. This is an organ for hearing. But then multiple organs gather together to form a system. And a system now works to do something, unique. So, for instance, you have the nose, the windpipe, and the lungs gathering together to do the work of respiration. So you breathe in, you breathe out, because your lungs is working with your windpipe and your nose. If any one of them has an issue, you will start having issues with breathing. So if for anything your nose is stuffy or blocked, breathing becomes a challenge. And then the heart, and then where blood flows, they form a system that circulates blood. And why is circulation important? It is important because you eat food, and food goes to the stomach and remains in the intestine. If there is no circulation, that is where the food will remain. But circulation ensures that food is picked from intestine and taken to where the body needs it. For energy, maybe the man is a farm worker, or you are trying to pound yams, or whatever it is. Then the brain also, with the nerves, form what is called the nervous system. So you are able to see me because you have a sensation of sight. You are able to hear me because you have a sensation to hear. And if someone pinches you with something painful, you have a sensation of pain, and you can run away or withdraw from it. And the kidneys and the bladder and other structures gather together to do the work of producing urine and removing urine out of your body. So the systems are like that, up to, of course, the digestive system, you eat and all that, and even the sexual parts, where, reproduction and sexual intimacy occurs. Now, these various organs can give a hint to what is going on in our body in such a way that a disease affecting the entire body may be picked from, some signs occurring from one. And even scripture would allude to that. And in the next slide, God was promising the children of Israel, if they continue in their unruly behavior, he said, I'm going to punish you. I will bring sudden terrors upon you, wasting diseases, right? And burning fevers that will cause your eyes to fail and your life to ebb away. So there is a connection in such a way that you can have a disease and then your eyes can begin to manifest. And in 1 Corinthians, the Apostle Paul would also even mention that if one part suffers, every part suffers with it. So you could have a problem with your digestive system, but then your whole body feels weak. Or you even begin to feel dizzy. And then you can even be very, very irritable and all of that, okay? So these manifestations that these systemic diseases, okay, so these groups of organs that do all this work, the manifestation can be sudden, or they can be such that they are gradual and they progress and progress and progress. Usually the one that is more dangerous is those gradual, progressive ones, because most times you'll be tempted to feel there's really nothing that is seriously going on. But if something suddenly happens, you are probably maybe forced to go and seek help. But the thing is that most of the sudden manifestations are potentially reversible. But those gradual, progressive ones, may lead to permanent loss of whatever function of the organ. So what I would do is to take us through some of the eye, because again, the idea is to say, can our eyes tell us if something is wrong with our whole body? So I'll just take us through some of these systemic diseases. But then looking at some of the eye manifestation, but then I will do it in such a way that we're not just looking at the eye as in the eyeball only, but everything around the eye. the muscles that control the eye, as well as the eyelids themselves. So if we begin, I will even give a true story of a patient that was referred to us. This was a young man in his 20s who went to see the eye doctor. And his complaint was that he was having difficulty seeing clearly. But then when the doctor looked into his eyes, he felt concerned to say, no, you need to go and see a group of doctors known as internal physicians. So the doctors that see you for diabetes, hypertension, kidney disease, liver disease are called internal physicians. So he sent that young boy to us. And by the time we checked, we realized this is a young person in his 20s, but his blood pressure was very, very high. And then further investigations revealed that he had kidney disease. So he came to the hospital with an eye problem, but then the whole thing ended up leading us to the kidney disease. So it's to still strengthen the statement that, the eye can truly be a window to whatever happens, to our whole bodies. So one systemic disease is hypertension. And hypertension can affect the eyes in such a way that somebody who has hypertension, particularly if the rise is very sudden, the person may have blurred vision. So you are seeing, but you are not seeing. The way that man who was born blind, and he said, I see men like trees. So you are not sure what you are seeing, or you may see double. And then it can even lead to blindness. Now, some of the changes in hypertension, like I told you, that young boy that came, the doctor looked using an instrument to look to the back of the eye and saw some things that made him feel alarmed and sent this young man. So there are things the eye doctors see at the back of our eyes that can tell us that there is a problem. And this problem is affecting not just the eye, but the whole body. So hypertension can lead to changes in the eye in such a way that the eye may not do its function. Where blood is flowing, will the channels, the tubes where blood flows can change in their size, and they can become so widened, and they can even burst, and it can bleed, and all of that. Now, diabetes is another systemic disease again that can also be picked from the eyes. If your blood sugar is very high, because of the high concentration of sugar, it will suck, whatever water that there is. So the sugar is also in the eye itself. And so it will make the eye to fail to be able to focus properly. So somebody whose blood sugar is very high would also have this difficulty seeing clearly. So again, it will be blurred, but then this blurred vision can be sudden. So again, if the sugar just rose suddenly, one of the ways of knowing may be that you are not seeing very well, or you are seeing double. But then it can also be such that you are not seeing, but it is going gradually. Again, like I mentioned, those gradual ones are the ones, we need to be very careful with. Then it can damage the lens of the eye, such that the lens becomes not clear, and the person will not even be able to see. And then these blood channels can be damaged. They can break, and bleeding can occur inside the eye. These blood vessels can grow so much that they block where the fluid in the eye freely flows, and then the pressure in the eye, increases rapidly. So just like we have blood pressure, the eye also has eye pressure also. So the pressure in the eye can be so high that it can begin to cause the person to lose vision. And then the person can lose vision in different ways. It can be that, yes, you could see, but you are not seeing very clearly. Or you could see, but then, I am standing like this, but I know there are people here. I know there are people here while I'm looking straight. We call that your peripheral vision. But then diabetes can eat up those areas such that you are only seeing straight. So if there's somebody standing here, I may not know, or somebody standing here, I may not know. And different degrees of loss of vision can occur because of diabetes. Okay? High cholesterol can also give a hint in the eye. And there are ways you can pick it from the eyelid, that there may be some things that deposit around the eyelid that may be a pointer to high cholesterol, or even in the white of the eye itself. So if you go to the next one, I will just show you a few pictures. So if you look above, towards the nose, the bridge of the nose, you see some things that look a bit like yellowish, right? On the eyelids. Okay, I won't use any medical terminology. So there are deposits that tell us that this person may have high cholesterol. Okay, so if you see somebody who has this kind of thing, one of the tests you want to do is to go and check the person's cholesterol, and you may just find out that the cholesterol is high. Okay? So the little challenge will be in the black skin, because it won't come out yellow like this for we who are black people. In fact, some people say there is racism in medicine. So particularly for skin disease, and some people feel it is true. So a lot of black people are, you fail to pick the disease early, because the books are usually books that have pictures of white people. And so you can't tell. For most of us, it may just be one black something around that area. Okay? But you see something raised like that around the eyelid, then we may need to start asking questions. And then if you look at the eye, there's a white ring around that black portion of the eye. Okay? So again, I'm not going to use the medical terminology, but it is like a ring around the eye. It can occur normally in elders. So maybe if you look at your grandfather's eye, you may see this. But if I see this in a young person, then I would really want to ask questions and say, let's check this person's cholesterol. It may be high. So the eye can give us a hint about that. What about stroke? Stroke can also cause eye problems. Again, blood vision is occurring many times. And then it can cause a kind of blindness that is very sudden. The thing about this one may be that this blindness may be a warning that a very big stroke is coming later on. So the person may lose vision for a short time and regain it. He may lose vision for a short time and regain the vision. But then it's a warning that a big thing is coming. So they can have this sudden but reversible blindness. And then if the stroke occurs, the eye may not be able to look in all directions. So again, you go to a hospital and doctor may use either a light source or use something and say, look at my hand, and then you are following, and then you may find out that the man cannot do and follow everything like that. So the eye muscles may be paralyzed. And then again, there could be some bleeding, even though that one may not necessarily be because of stroke, but you could sometimes see a bleeding inside the white part of the eye. That could also be a pointer and tell you that we may have a problem with stroke. Okay? Now, allergies can also affect several systems, but again, you can pick allergic reactions from the eye. The eye would itch, the eye will be red, and then the person will be tearing. Okay? So if we see that also, that may be a pointer that the person may have an allergic disease. And you may find out that by the time you start checking other parts of the body, you may see other things that may point to an allergic disease. So go to the next. Of course, so the eye will be red. Okay? I used to have, red eyes. I think up to my 4th year in medical school, and I remember one of the doctors when I was a medical student, the day he saw me, he said, this boy is taking ganja. He thought I was smoking Indian hemp, but then it was just allergy. The eyes would itch very badly and the whole eyes would be red. Okay? And then the eyes could also give us information if the liver is not working well. So the white of the eyes too become yellow. And then in some kind of liver disease, the body will itch. So again, the itching may also involve the eyes also. And then there's a picture to show that also. So again, the white of the eye looks yellow. Okay? And that may tell you that the person may have some issues with liver disease, even though, well, yellowness of the eyes may not entirely mean liver disease. If the blood in the system are broken down too quickly, it can cause this also. Or sometimes if there is a very bad drug reaction, it can also do this. But yes, this may be a strong pointer that may tell us that the liver may be at fault. And then there are certain kinds of headaches too that may also be picked just from the complaint of the eye. I'm sure you've heard of things like migraines. There's another kind of headache called cluster headache. They can be very, very nasty headache, one-sided. The eye may pain, one eye will be tearing, and then, it will look as if the person is crying, but is crying only in one eye. And then bright light like this, the person may not be able to look straight into the bright light. But then there's another very bad kind of headache. Usually they will describe it as the worst headache of their lives. They say it's a thunderclap headache. That kind of headache, if somebody gives you that complaint, it may point to a bleeding in the brain. Okay, and again, there's a way you can look into the eyes and see the bleeding. There's a way it will bleed inside the eye. So the eyes can give us information, in such a way that you can pick other things. Now, I want to talk about the kidney, the kidneys. I'm not sure why the slides are not really coming out the way I made them. But the kidneys can also, if they are affected, you may pick them from the manifestation in the eyes. Well, first of all, for many people who may have kidney disease, there may be nothing. But then the eyelids could swell like this one. So swollen eyelids, yes, some may say it's because I didn't sleep well. But if it keeps occurring every time, then you probably may need to have your kidneys checked. And usually it is puffy in the morning, and then as the day progresses, it will disappear. Those are early signs of kidney damage. And then it will now become more permanent, like that. And then the same issue of blurry vision and all of that. Okay? So now, let me give us another interesting one that you can also pick. The Bible in Ecclesiastes 12, it tells us to remember our Creator in the days of our youth, before the days of trouble come and the years approach when you will say, I find no pleasure in them. So look at verse 2. It says, before the sun and the light and the moon and the stars grow dark, and the clouds return after the rain. So it's referring to your vision. Okay? But this is actually not a disease, but it's just something I want to just say that as long as we are alive, our bodies are not, created to remain the way they are, permanent. Okay, so just go to the next one. So, of course, as we get old, the body also becomes old. And the eyes also will begin to tell you there is problem. Mm-hmm. So you find out that before you could carry a paper and read, then you now start finding yourself doing like this. It tells you that the lens of the eyes are also becoming old too. So I am short-sighted, so I can't see things very far clearly. But of recent, I now realize I am better off without the glasses if I'm reading something in my phone. And so the eye doctors now say, you need to have a bifocal lens. So I'm wearing bifocals. Of course, that just means that we will age. And the same way the gray hairs will come, the gray hair of the eyes too would also be that the eyes will become weak. It won't be as strong as it is. And some of this problem of seeing would be there. Indeed, are there scriptural stories to allude to this? Yes. How did Jacob trick his father? He used the fact that old people may have old eyes and won't see very well. And that was how he was able to trick his father. Okay? So again, I just want that we go through some of the very familiar systemic diseases. There are many of them. Some of them are diseases where the body fights itself. Okay? Maybe the example would be what the military people would call friendly fire. So you are fighting bandits or fighting whatever, but then in the course of maybe the jets dropping bomb, they now drop bomb on the same military people who are attacking the enemy. So the body sometimes can mistaken an organ, to be a foreigner and attack it to such a point that it can damage it. So there are some of these diseases where the body damages itself that may show in the eyes too. The eyes become very dry in some disease condition. Or sometimes the eyes also become red and painful. Or sometimes the person develops blindness, but then he goes to the doctor, and the doctor sees the eye, and the eye looks normal. So there is a disease like that, and the cliche that is used is they say the patient sees nothing, and the doctor sees nothing. So you look into the eyes look normal. But the mind is telling you, I can't see. Okay, so there are diseases of the nerves where the body targets the nerves and damages them, and then the person cannot see. And then there are some diseases that also pass from family to family that may also come with eye issues. So there are some kind of kidney disease that will come with a family history of eye problem or deafness. So if there is that history, even if the person's kidneys are not diseased, you want to, begin to check and all of that. Okay? So we would talk about how, what we need to do and why we need to do this detection early of these systemic, diseases. So the first thing I want to mention is that as people of God and as God's children, we need to understand that all truth is God's truth. If you study the history of medicine, modern medicine started in the church. It was the priests who were the doctors, okay? So in the history of surgery, there's what they call Baba surgeons, and the priests were the ones doing surgery in monasteries, and then it took the Pope to say, no, the church shouldn't be dabbling into blood and all that. And that was how hospitals were now separated from the church. But if you look at scripture too, there are instances where you see that role of the priest doing the work of a physician. So in the Old Testament, if there is leprosy, it is the priest that will come and examine. And if the thing is like this, the priest will say, you are unclean, and you remain unclean. Or if the thing has gone, it's the priest again that will come and examine, and say you are clean. Okay? At that time, the priest was a physician also. And then Jesus, when those blind people came, told them, go and show yourself to the priest. Okay, so again, still mentioning the fact that the truth in medical science is the truth of God. Is the truth from God. And faith can be used as a double-edged sword. It can be used as a sword that can aid in recovery. And it has been scientifically proven that people of faith actually do better in their response to treatment than someone who does not have faith. The group of people who have faith and their faith usually is not advantageous will be, let's say, these new age people who say, I am my own God, okay? So when you now become sick, then you say, I have failed myself, But if you are looking up and, they say when you are sick and you are lying down, you are only looking up and you are looking up to God for help. Okay? So faith and science are not worlds apart. They are actually very, very close together. And studies have shown that people who have faith respond better. Okay? So why do we need to detect these systemic diseases early? Why do we need to detect hypertension early, diabetes early, and all these other things? It's because, again, like this statement, an ounce of prevention, again, is better than a pound of cure. It is easier, it is more convenient, it is cheaper. Okay? So we need to, first of all, accept the fact that, okay, God has given some people the wisdom to create gadgets and create apps on the phone, and I can use it for so many things, and that is still wisdom from God. God has given some people wisdom to understand how our bodies work and all of that. And so to refuse to either accept or sit on it is not helpful. It's not helpful. And a good example I would give would be with hypertension. Now, hypertension is such a problem that majority of people who have hypertension have not even been diagnosed with hypertension. And then majority of people who have been diagnosed with hypertension are not on medication for hypertension. Because again, majority will say, no, I don't believe it. If I start taking medicine, that is how it will go on and all that. And then majority who are taking medicine, the medicine is not bringing down the blood pressure because they are also not adherent to their medications. Okay, so let's move on. So the problem of hypertension is like that of an iceberg. So you are only seeing a tiny part up because most of it is still way down there. All right? So before we started, somebody mentioned know your numbers. And I think that would be the one window where we can go in to say we want to detect these systemic diseases early. And what are these numbers? What is your weight? What is your height? And then you can use the weight and height to get what is called your body mass index. Again, if you don't want to calculate, a lot of the phone apps have apps for you to be able to calculate. So you just put in your height, put in your weight, and it tells you. And so once your BMI is above 25, then you know that you are beginning to struggle with overweight. And if it begins to go towards 30, then you know you are becoming obese. Okay? And all of that. Know your weight. Okay, we've mentioned that. Know your blood pressure. Again, all of these are things that, they will just check. But then you can also get some investigations done too. Like we can check our urine. We can check the blood for sugar or check the blood for cholesterol. Okay? So all of these numbers are simple will that can give us a hint. And just like Jesus would say, if your eye is good, your whole body, will be full of light. So if we are beginning to have some things in our eyes that tells us that there is a problem, then it's good to quickly find out what these numbers are and seek help quickly. Now, I am a kidney specialist by training, and this is a beautiful opportunity to just educate us a bit because every second Thursday of March is the World Kidney Day. And the World Kidney Day just is a day for us to create awareness about the kidneys. All of these disease conditions that I mentioned, I'm not being sentimental, but you will say the kidney disease is like the baba of them because hypertension can cause kidney disease. Diabetes can cause kidney disease. Okay? Almost all of these diseases will eventually cause kidney disease. So if we are able to take care of our hypertension, you are taking care of your kidneys indirectly. If you can take care of your blood sugar, you are taking care of your kidneys indirectly. Okay? And there's a very short video that's less than 2 minutes that, if it can be played, will just give us an idea of what we need to do to take care of our kidneys. just as football fans will say Man U for life, Arsenal for life, Chelsea for life, we would also say kidneys for life. So if you treat your kidneys right and you know your numbers, you'll be protecting a very important organ and by extension systems in your body. Thank you very much.
Thank you very much, Dr. Gimba, for that wonderful presentation. You can jot your questions and hand it over to me or Dr. Elijah here before the time comes for questioning. So we'll call on our next speaker for the Health Awareness Talk 2, who is Dr. Victoria Ma'an, a hematologist, consultant hematologist in the Jos University Teaching Hospital. You're welcome, Ma.
Good evening, everyone. I greet us all in Jesus' name. First of all, before I start, I would like to say thank you to the elders, the pastors of this church, for giving us yet another opportunity to come and create this awareness for blood donation. We were here last year, and we would like to say thank you so much for those that donated, even for those that didn't donate, at least for sitting and listening to the talk. We say thank you so much. May the Lord continue to bless you. And I hope that, and thank you to the medical team for inviting us again for another blood drive. May the Lord continue to keep us in good health. And before I start, I would like to say, my colleague just said kidney for life. I want to differ a bit. I think blood is blood for life. Because without blood, you cannot be sitting here. That's the truth. And without the blood, the kidneys will not function. So everything is blood. That's why I love blood. I love blood because blood is everything. So we would like to talk about why we need to donate blood, and also to remind us on the types of blood donors we have, because we have different types of blood donors, and also how we select our donors. It's not just anybody you see. Just where I come, or anybody that comes to donate blood, that you just take blood from. No. We have the criteria we use to select the people that are fit to donate blood. They will know the benefits. Giving out your blood has some benefits, actually, to you as a person that is donating. And also, it's not without hazards. There are almost everything in medicine, or let me say everything, even the drugs we take, they have some side effects. You understand? So we'll summarize and now we'll conclude. So in the book of Leviticus 17:11a, it says, "For the life of the creature is in the blood." So your life is in the blood. Blood is life. And blood is a very vital fluid that circulates in our system. It carries all the nutrients we need, vitalizes all your tissues, carries oxygen to all the tissues, and after they finish using it, it's the same blood again that will now carry them to the kidneys, to wherever they're supposed to be excreted. Then they will be excreted. Then you now now be okay. So what is donation? Donation is when you give to charity. You donate to someone that is in need. Most donations are done, if not for this era, that people will donate for people that already have. You see a rich man, somebody that is very rich, somebody is giving him, is it Ferrari, whatever, he already has. You understand? But donation, when you donate to charity, you give to somebody that is in need. And actually, that person will appreciate it more. Whether the person knows you or not, at least you pray, oh, the person that gave me this life, may the Lord bless the person. So donating blood actually helps to supply blood to the hospitals. Because if you and I don't donate, hospitals will not get blood for patients in need. And also, according to American Red Cross, for every 2 seconds in America, there is someone that needs blood. For every 2 seconds, that's just America. The world over, people need blood every now and then. And also, in Jude, approximately every day, we issue out about 24 units of blood. That's on a normal day. Aside, if there are mass casualties, there are attacks, communal clashes, that one, you can issue up to like 100 or more in a day, because you have a lot of people to give the units to. So you can see in a week, at least 160 units goes out. In a month, 672 units. So if you and I don't volunteer to give blood to save another man's life, we cannot be able to sustain it, because you need people to come out and volunteer to donate. So why do we need to donate blood? We need to donate blood so that we give the people in need. Who are those people that need transfusion? Most times, people that have blood disorders, somehow their marrow is not producing, or they have some cancer or some form of blood cancers that is affecting their production, the blood producing blood. So they need us to donate for them so that they'll be able to survive. People with cancers too, most of them, they come for chemotherapies, maybe sometimes twice in a month, sometimes every month. And most times, those drugs that you normally give them affect also the normal cells. So they always need transfusion. In fact, some of the cancer patients, for every month they come for medication, they must take at least a unit of blood. Victims of crises, communal clashes, and also victims of accidents, or anybody that has an injury with significant blood loss that will need transfusion. And other medical conditions too. There are some medical conditions that the patient will have anemia, will need to be transfused. So that's why we need to give blood to save their lives. So what are the types of blood donors we have? As I said, we have different types of donors. We have replacement donors. And these replacement donors, they are non-remunerative. That means you don't pay them, but they are directed. Directed in the sense that I am replacing for my patient. So if they are usually relatives of the patients, so maybe you have a patient that needs blood, you bring a donor to donate, or maybe they have transfused, so you now bring the donor to replace what has been given to your patient. So we call those the replacement donors. And sometimes we have issues with this kind of donors, replacement donors. Some of them, when they donate, they will tell you that it must be that unit that should be given to their patient. And I think we had an issue some months back, late last year. Someone came, he's a very prominent person, he came and donated for his relative. So somehow, there was an emergency that came in, so the person on the reception now took that unit and issued out to a different patient. So when he came the next day, he now asked, he has come for his blood, they want to go and transfer the patient. They now told him that, sorry sir, the blood, we have used it for another patient. It was talk of war that day. He said, for where? That we have to go and look for that unit and bring it back. That his blood cannot be given for just anybody. You know, he said so many things, but at the end of the day, God helped us and we were able to calm him down and explain to him why we had to give out the unit. So this is one of the disadvantages of replacement donors, because you have the right, you feel you have the right on the unit, because it's your own unit, so it must be used for your own patient. And sometimes the donors, the replacement donors, because we are in their need, you conceal some important information. Maybe they have some risky behaviors of transmitting infections. They will tell you no, because we have our forms that you fill. Most times because you say, if I say yes now, these people will not allow me to donate to. So they will tend to conceal important information. And sometimes even health information. Somebody will tell you that he is okay, he has no problem. Meanwhile he knows, but because of the pressure, maybe most times they feel, if I don't donate, okay, where will I get units for somebody to come and donate? And sometimes some of those relatives, if they can't get someone, they now go for paid donors. They go out there, see someone, pay the person, and the person comes and donates for them. And actually, it's using paid donors is actually expensive. Because number one, if you go there, it's expensive for the patients, because if you go, you get the person, maybe the person will now charge you, say, okay, if I'm donating blood for you, you give me 10,000 or 15,000 with this economic situation. So when you now pay the 15,000 and you bring the donor, and maybe if the person is not close to the hospital, you have to transport the person. When you transport the person and the person comes and donates, we will charge you, you will now pay for the services again. So it is actually more expensive to get, for the patient relatives, to get somebody that is a paid donor. So we have, as I was saying, the paid donors is another group. They are professional donors. There are some people that they live on donating blood, because they pay. And now you have something that will give you food. So they feel they will come and, they will pay. And this kind of donors are actually discouraged because according to World Health Assembly, the blood donation should be voluntary, and your blood without being paid. But these people, they are violating that rule. So it's actually discouraged. And most of them, they have the high chances of TTIs because some of them, they do so many things. So they only donate because of the money. And most times, they don't tend to tell you the truth about what they do. They conceal, they conceal a lot of information, and they tend to donate more frequently. In fact, there was a time we had an issue, even not because we asked him some question and made him to reveal that he had donated like 3 weeks past. So somebody met him and paid him. I wanted to pay him, so he now came again. So when they were asking, he filled the form, then they were asking him questions. Then I asked him a tricky question. I won't say it. So he answered, he didn't know. So we were able to find out that actually he donated like 3 weeks ago. So he was disqualified, and he wasn't happy about it at all. He felt we have scuttled his plans. So the third type of donors are the voluntary non-remunerated donors. According to the resolution of the World Health Assembly, the principle of blood donation should be voluntary and non-remunerated, And these voluntary donors are people that they don't donate for a specific person. They just give their blood. You can use it for anybody, and you don't pay them. And this kind of, these voluntary donors, they can actually, a donation for them is like a principle. We have a lot of them. Some people just walk into National Blood Transfusion Commission, National Blood Service Commission, and donate without even you calling them. Once it's 3 months, they will go and donate. In fact, there's a church, one of the Kokin churches in Tudumada. We went last year, August, when it was 3 months. They sent for us that we should come back. It's already 3 months for us to come and for them to donate. So we had to go back together. So they make donation as a principle for them. The reason why we promote voluntary donation is because there's no risk of transmission of infections, because you are sure of yourself. If you are not sure of yourself, I think you will not be that bold to carry yourself and say, I want to come and donate blood, just like that. Because they are sure of themselves. So, and they don't conceal any information. They tell you everything the way it is. And they are more likely to donate regularly. Anytime there's mass casualty, they will just volunteer and come to donate. In fact, the last time the school incident happened, one of the politicians, just because he normally donates blood, he just brought in a lot to the National Blood Service Commission. He came with a lot of people, to donate for that. So I've already said they are not financially motivated. If there's any appeal, they actually respond to that. Then we have the fourth one, autologous donation. You can donate for yourself, actually. If you have like an elective surgery, you can come to the blood bank. You're okay. It's elective. It's not as if you are sick. Or we take your PCV. If it's okay, then we give you time. You donate. But you don't donate just before the surgery. No. You donate for 2-3 weeks before the surgery so that your bone marrow will be able to produce new cells that will be enough to take care of that. So we have a guideline where you can do autologous transfusion. Actually, most people are advocating more for that, for people to be donating for themselves if they are going for especially elective surgeries. So what are the criteria we use? Acceptable criteria are you should be an adult, male or female, 18 to 60 years we use here. For some places, 65 years too. In fact, in some countries, they use 70. But most times here, by the time someone is getting to 65, a lot of medical conditions are already clouding everywhere. So you may not likely donate. And you should weigh more than about 50 kg. The hemoglobin level for men should be 13 grams per DL, and for women, 12 grams. So the donation interval should be 12 weeks maximum. It's advisable to be 16, but 12 weeks, which is about 3 months, you can actually come back and donate. Your BP should be less than or equals to 180 systolic and diastolic 100 equals to 100. The pulse rate is there. Then we'll take your temperature to be sure you're okay. For the exclusion criteria, we have criteria that if you don't meet, you will not donate blood. If you are pregnant, because you yourself, you need the iron. If you have any cardiovascular disease, your BP is more than 180 or 110, we don't take. If you have any respiratory problem, epilepsy or GI disorders, chronic disorders, we don't take. If you are undergoing any medical treatment or clinical trial, then if you are going to return immediately after donating, you're going to return to any heavy duty, like driving all these big buses, plane or train, any heavy machine, any heavy duty, we don't tend to take. Then what is the benefit of donating blood to the person donating? There's a free check. We check your pulse rate, your blood pressure before we take your blood. Your temperature should be okay. We check your hemoglobin level. And when we do all these checks, it will help us to know if you have any underlying, because as he said, some people are moving with high BPs without actually knowing. So if you come, we check. If it's there, we will know, and you'll be advised accordingly. And also, if you have any risk factor for any of the diseases. Secondly, your blood will be screened for hepatitis, HIV, syphilis. The third benefit of donating blood is that if you donate blood, as you are removing, your bone marrow is producing new cells, and those new cells are stronger than the old ones you are giving out, actually, and they make you feel better. It's just like you have an adult or an elderly person with a child, you ask them to run. The child will reach there and rest for maybe 30 minutes before the others will reach there. So that's how it is. If you have young cells, they act better. The regular blood donation can reduce the risk of heart attack because the iron we have in our systems, there is no way that it's being excreted. It recycles itself into the system and gets stored into our organs, and some tissues. So because it's not excreted everywhere, you stand the risk of having a heart disease. But if you donate, as you are removing the iron that is in your system, you reduce the iron. The ones that are stored will go to the marrow and you produce new cells. So you are reducing the load to the organs. And also, being part of a greater community, we have a community of people that are blood donors, actually. If you go to National Blood Services Commission, you have a lot of people, they have registered. We are trying to establish that too in Jute. We've started having some people actually coming to donate voluntarily for people. What are the hazards? Fainting. And fainting is common in the first timers, especially young people, Sometimes when they see the needle you use in taking the blood, they're already scared. And seeing the bag, this big bag is going to collect her, So by the time when you are now done collecting, they will, because they are nervous and apprehensive, they may have some form of fainting. Delayed fainting too could occur in some people after leaving. They could actually have that. The venipuncture site, though, is very, very rare because of how we do it. can get infected. You can have some bruises around that site, especially people that have difficult access for transfusion. Very rarely, some people may puncture the arteries actually, but it's very, very rare, you know. So in summary, blood is life, and it's the most precious gift you can give to anyone. Donation is a simple process, and it's a very effective way you can help others. You may not have money to give people, but you have blood to give out. So you can actually give your blood out to someone. And it can offer you emotional, and physical benefits. You know, when you donate, and you know that my blood is going to be used for someone, you know, you'll be happy about it, and you feel, at least I've saved somebody's life. Jesus saved me and shed his blood on the cross for me. At least I'll give somebody my own blood in the system so that he will live, you know. So you try to avoid strenuous activities immediately after donation because it helps to minimize the side effects. And most times most of the donors, you can resume your normal activities, just rest for some time, and just the normal, regular activities at home, wherever you are, you can actually resume it. And blood donation should, in all circumstances, be voluntary. That's what we're advocating for. People should not be paid for blood because you cannot buy life. Life is a gift. God has given us freely. So we should learn to give others freely. In conclusion, creating a moment of kindness during a time of need does wonders for your mental health. When you sit now and you now think, I've given blood that will save someone, I think it will help you. This is written by someone. He said, I really feel good after I donate, especially when I get a text message to say which hospital when you get a message and they tell you which hospital your blood has gone to. In our case, they may not text you that this is what, but you sitting in your house and knowing that, I've given my blood and someone in need is going to get life, I think that will make you feel good, you know. So a decision to donate your blood can save a life. Don't wait until there is disaster, until when they start calling everybody, come on, we need blood, you know. Just give blood. Give it now. We should form the habit of giving blood often. We should donate blood to save lives. Before I'll finish, I'll sit down. I would like to say something. I've said it the last time, that most people will say, even some health workers, they will say, we sell blood. Please, we don't sell blood. Any money you are paying to access a unit blood, you are paying for the services, for all the processes that is carried out on that unit of blood to make sure that the blood is safe for the recipient. It's not that we sell the blood. No, nobody can sell life. Life is a free gift. So please and please, I would like us to know that we don't actually sell blood. Thank you for your attention.
I think we can do better. Give the two of them a round of applause. Thank you for your wonderful presentations. It's time for questions, if there is any. Okay, I don't know whether we'll pick numbers or I said they should write. Anybody has written a question? Okay, so we'll pick numbers. Okay. 1, 2. Only two questions. Okay, we'll pick the 2 questions. 1 here, sir. Sorry, thank you. 3. So our presenters be listening to the questions while we give your response. We'll take the question first before the response. Thank you.
In church. Actually, she has quickly answered one of my questions. I wanted to ask 2 questions, but she has answered the one of selling blood. And even though it's not too explanatory, but let us leave it at that. Now, I donate blood. I've been donating blood for a very long time, more than 30-something years now, though not too frequently. The last time I went to donate blood, I have a card with Plateau Hospital. I used to donate former Jude, Eldin Hospital, and so on and so forth. But presently, I go to Plateau Hospital. I never knew actually that when you donate blood, after 2 weeks, you go and they tell you if you have any health challenge. Now, when I got to know about it, I went and the lady interpreting the results told me I had syphilis. Quickly, I called the head of the blood bank. You know him now, Dr. Damulak. I called him immediately when I was at Plateau. I said, where are you? He said he was at Jude. He has an office at Jude University and there. When I went there, he now tested me again, and there was no syphilis. Now I asked him, I said, now what happened? He said, most likely the reagent they use was, I don't know, he used one language. Now the question is, if I had not gone to do a second test, it will be I have syphilis. Last year, I gave blood here, Dr. Sado, around somewhere. The same result with the last one, they say I have syphilis again. I quietly went to one hospital and they gave me, I gave a testimony when I was giving a lecture on medical negligence here. It was me. They treated me. Now the question is, why is it that if you do a confirmation test, most likely you have a different result? Thank you.
Okay, number 2. Okay, number 2, sir.
Good evening, Church. My question is there any impact of blood donation on the immune system? If there is, please, can you shed a little light on that? Thank you.
Number 3, sir.
Hello, good evening. My questions goes to the first presenter. I don't know whether you are the first presenter because I came late anyway. Presently, I attend MOPD clinic under Professor Poppet. You know, he's the one taking care of my this sugar something problem. And the second one is I'm also attending eye clinic under Professor Adelnega. So which means I have 2 problems. Now, the third one, which I wanted to join again, I retired in Jude anyway, so all these departments, I know them, and some of them know me. So I don't suffer there. If I just go, I will see the doctor direct. But you, I know you, but I don't know where your clinic is. Now, my question is, how will I now start attending your clinic to be checking my kidney?
Yeah, well.
Based on your presentation, you said if you have these 2 diseases, you know you are prone for something like that. So how will I even start attending your own? So that's my question.
I think we are done with the question, so I will give the Mommy Jumbo.
Yes, we've been told that when you pay to get blood to be given to you as a patient, I mean, it's free. What happens when you pay, if you're about to get a surgery, have a surgery, you are asked to pay for some units of blood? It ends up that you are done and you didn't need the blood, but your money is not refunded. How does it come about?
Okay, I'll give the presenter this time around so that you can start. Dr. Mahan, you can start.
Okay, regarding the test, you know, in every test, you have the human factor and the reagents too. So sometimes it depends on the person that is conducting the test. And the test that is done in MBTS, I know, is ELISA. You don't do anything out of that, you know. And sometimes when you are doing ELISA, you can get contamination. Do you understand? So if you decide to go to another place, I don't know the second place you went to, is it the rapid test they did to confirm it or what? I don't know where you did the second one, the rapid. And sometimes the rapid, it depends. It's not every rapid kid that is sensitive to pick the infections, you know. There are some rapid tests that for you to be sensitive, for you to be very specific and sensitive, there is a particular level. Maybe if you have the disease as a very lower level that it peaks. But some of the test strips you have, actually they have not been validated or whatever. They don't really, you cannot really rely on them. Do you understand? So that's the problem we're having, because most times the reagents we have, especially the rapid strips that we have, they are not that sensitive to pick the infections at a very small, maybe if the thing is at maybe 0.0 something level. It has to be more than that. Do you understand? In fact, I'll take your number personally too, so that I'll make sure that they do it the right way, so that we'll know what is actually the problem. Then about immune system, I think someone asked about boost the hair. Okay, the blood donation actually, just as I said, the red cells, you know, when you remove them, it's not only the red, when you donate blood, it's not only the red cell you are removing, no. You are removing the red cell, you are removing the plasma, which is the, let me put it in a civil language, is the water, whatever the blood flows in. You are removing the white cells, which are responsible for the immunity. You are removing the platelets, who are responsible for clotting of blood. So when you donate blood, all these cells will produce new ones. Do you understand? So when they produce new ones, those new ones are stronger than the old ones, just as I explained for the red cells. So they will tend to boost your immune system. Do you understand? And so it's like you are giving the old and new generation is coming up, which are stronger than the old ones that you give out. Then payment done in June. I don't know, for surgery, what we do is that when you are paying for units of blood, you don't pay with surgery fee. You pay for, you come to our department, blood bank, we bill you and you pay separately. In the case that if you bring a donor yourself, and you don't use the units, nobody will return the unit to you, and you cannot give the unit to another person. It has become hospital property. Now, if you pay for a unit in jute, and they don't use the blood, if it is jute that you pay the money to, we'll just give you a slip and your money will be refunded. If you go to NBT, National Blood Service Commission, I'm sure that's where the problem is. I'm almost certain. Because we've had that issue. If you go to National Blood Service Commission and pay there, once your blood enters our blood bank, we don't give it out. You understand? And we will not refund the money. Reason being that we have a part with National Blood Services. You understand? If any patient that needs blood, they're supposed to come to blood bank, who will arrange for National Blood Services to bring the units to us on what we call linkage. So you don't pay in national services. So when we use the blood, then national services will bill us. We bill you, then Jute will now pay them. Do you understand? So on several occasions, some people, maybe I don't know how, we've sent notices, circulars to tell people that don't do that, send the patient relatives who will call MBTS to get blood. Even if the patient relative is going to MBSC, we will call them there, they will not collect money, they will only give you a slip with the number of the units and their numbers and the blood bag unit numbers. Then you bring it to us, they will bill us, then we will now pay them. Because the issue of refund has generated a lot of problems for us using their receipts. You understand? So that is just the thing. I'm sorry if it has happened to you, but there's nothing we can do about it. So somebody wrote a question: do you rely on interviewing the patient before collecting the blood, or do you take samples to test for major illnesses before allowing donations? We give you questionnaires to fill. We have our questions. So you donating blood depends on what you feel on that questionnaire and the vital signs. So when you finish filling, we'll check it first and we'll take your if your feeling is okay, you answered all our questions correctly and we feel you didn't meet the criteria, then you cannot donate. But if you met the criteria, we'll check your vital signs and you are okay, then you go ahead and donate. You understand? Well, if you feel false information, that's left for you. That's the truth. That's left for you. And we do your vital signs and you're okay, because we can't know what is the truth in you. You understand? Because sometimes some people, even if you interview them, no matter what you say, it's unlikely that they will tell you the truth. As I said, especially that happens especially with paid donors or replacement donors. So I hope I have answered. Thank you
very much. Yes, thank you very much for the question. So the diabetes clinic is run by doctors who are called internal physicians. So Professor Puppet is a physician, just as I am a younger physician. So some of these tests, any physician can run them. In fact, any doctor should be able to run them. And what are these tests? It begins first by checking urine. So if you are afraid of needle, it's just to go and pee, and then they can check. There are things in the urine that may tell us that there is a problem. If there is a presence of protein in urine, and it is there, and it is not going, then it is a red flag that the kidneys need to be checked very well. Then there are blood tests that can be done to check how well the kidneys are functioning. Well, let me not assume for them, but it is very, very likely that in the course of your MOPD visits, sometimes they will ask you to do some blood tests. So sometimes this blood test is for this kind of things. Maybe what we sometimes fail to do is giving information very well. We should be able to say, okay, I want you to do this test. And when the person comes with the result, I should be able to say, okay, we've done this thing, and this is what we have seen, and this is where we are. We think your kidneys are fine. A diabetic who has eye issues, will be a diabetic that you would say, yes, pay attention to the kidney. Because the eye issue, the kidney issue, you find that sometimes they have issues with their legs, they have wounds that don't heal. We call all these things chronic complication of diabetes. So once you see one, you look for everyone. So it is very important that they need to pay attention. In fact, what should happen is that if a diabetic is seen for the first time, even if he's not complaining anything, he goes to see the eye doctor. If an eye doctor picks a problem in the eye, you must screen that kidney very well. Because again, the key to early detection is catching it very early. And there are people whose kidneys, yes, they have kidney disease, but many years they are living normal lives because it was caught very early and you are treating the problem. Most times where issues come is when nobody picks it and it is under the radar, and then the person now begins to come with those signs and symptoms. So it will be important. Maybe it has to probably come from both sides. Maybe you may need to ask them, okay, can you just check my kidneys? and let's see. So that if there is no problem, good. Because most times if there is no problem, you will still remain with them. But by the time they tell you they are asking you to see Dr. Gimba, then you know that but I don't pray that would happen. I pray that your kidneys will still remain, very, very functional and very well. And, from that little video that we showed, the things to keep your kidneys are very simple things. Healthy intake of water, exercise, eat healthy. They are the simple, basic things that we do every time. Cut down the amount of salt you take. Don't be habitual in your use of medications, okay? These are simple things that can protect our kidneys, and it goes for everybody. It goes for everybody. Maybe just one little bit about lab results that can be erroneous. I had a situation where I wrote a report for a patient, and the test came out that the man was HIV positive. And so we wrote the report because they wanted to be referred. And so we wrote, but then the family was like, no, they never knew this man had HIV. So it became a matter, but then we sat with our lab people, and we checked, and they said, this was what we got. But what we now did was, okay, please, take it to another lab. So we took it to a lab that, had accreditation. And then it was negative. So we had to issue a retraction to apologize that, so sometimes these things can happen. A doctor is not God. And sometimes sincere errors can occur. And if it is an error, then they should own up and say, we're sorry, that we did this in error. Okay. Are you still raising your hands? Okay. Yes. Okay, the kidney? Okay. Sleep. Sleep is a very big, there's what they call sleep hygiene, okay? One of the biggest robbers of sleep is this thing. So you are going to bed, and then on your pillow you are checking. All these things will cut off some beautiful minutes, if not hours of good sleep. And by the time maybe you've seen something very interesting, you are a football fan and your team lost, of course sleep won't come now. You'll be hissing on the bed and all that. So sometimes there are simple things we can do when it's time to sleep. Because again, it's not like you should switch off your phone. Emergencies can occur, but we can keep them away. Put off your light. Don't switch on the TV in the bedroom. You are done with watching the news, everything off. It's time to sleep. Close your eyes and sleep. God will give his beloved sleep. All right, thank you.
We want to thank everyone for coming around to attend this health talk. There's more coming up. Please make it a day to be here tomorrow. We apologize for the delay in projecting the first slide. There was a miscommunication. We sent to one of the media, and I have assumed that the ones that were on ground has the slides. So tomorrow, once I come, the first thing is to go there to be sure that the people that are on ground actually have the slides. That was the disconnect. So we apologize for that. Some of the announcements for tomorrow. Maybe help us know where to note it. So they say there's a question online that says that if you're a regular donor and you need blood, do you need to pay to get to access blood? Please it's an online, so let's let the person know, please.
Okay, if you are initially in National Blood Services, if you are a regular donor, they normally give first-degree relatives some concession. I think it used to be like 1 or 2 units. I'm not sure, I've forgotten. But along the line, as leadership changes, people change their policies. So along the line, I think they stopped. Okay. So I don't think it's done again. Okay. I'm not sure.
So the person that asked the question online, it has been answered. So God will see us through. So for tomorrow, we'll be starting by 9 a.m. We're working towards starting by 9 a.m. for the lecture. And we will be looking at caring for the elderly amongst us. Just like I said, we have people blessed in their 60s, in their 70s, in their 80s in this church. So the question is, what did they need to know about themselves? And what did we also, the younger ones who are hoping to be there someday, what did we also need to know about them so that we can be of help to them? Some of them, we have them as our parents at home, and we are battling with a lot of things, trying to understand why they do the things they do. So tomorrow will enlighten us. And then sleep is also a problem as people get aged. So, sir, that your question will also receive an attention tomorrow. Why can't elderly people sleep well at times? So please make it a day so that you can hear more. Now, because of the issues we have about, some of the tests we are running tomorrow, some people are supposed to come fasting. The test we call lipid profile. You need to take your blood while you are fasting. So you will not eat before you come. The same thing, those are doing fasting blood sugar tests. So because of that, the laboratory scientist has made arrangement for his staff to be here on or before 8, latest tomorrow morning. So if you are doing some of these special tests, please try and come very early. We want to use one of the rooms in the Sunday school building so that blood can be taken. Now what we advise is that you come with your meal, because people have different degrees of to what extent they can hold their tummy. And then there is what we call hypoglycemia. That one is even more dangerous than the hyper. So, particularly for our diabetics. So, bring your food. There's nothing wrong with it. Immediately they take your blood test, you can eat. Then you can now come for the lecture. Is it clear? Yes. So, I wanted to make that very clearly to us. We are still talking with the lab man what will be the final prices for this test. Some of you indicated for kidney function test. As at yesterday, when I was making the final entries, we have about 228 requests for kidney function tests, for lipid profile. Lipid profile is the one that captured the cholesterol that our first speaker was talking about. So those are asked for liver function test and all of that, just like we state. So you come on time so that your blood can be drawn on time, and then they can initiate the process of running the test. Once we have the lab, we can now interpret. So, okay. Sir? Okay. Okay. The BMI, yes, it will be done tomorrow. The numbers, your weight, your height, there will be a venue for it. Still in the Sunday school hall, we will set up the place where you can have your height, your body weight. We can calculate the BMI and tell you what it is. And we can give you an interpretation, what it means and what next you should do, both some lifestyle modifications that you need to adopt, and if there are tests you need to run so that you can probably have more information about your health. For fasting blood sugar, church make a provision to buy some strips. So first come, first serve. Those that come early may be able to access that. When I asked the other time, it was about 1,000, 1,005. So those that come early can be able to access that service. Our own lab will be running the fasting blood sugar free. But once our strips is exhausted, then you switch to the other lab where you have to pay. So that is one reason why you should come on time tomorrow. Now, for the concerns raised about one test that was positive and the other one turned out to be negative, Dr. Gimba has addressed that. We have about 6 persons out of the so many blood donations we had last year, close to 90. I think there was just about 5 or 6 persons that have that. You are just one that they detected something. There are some that have viral hepatitis. So it is those few persons we reached out to because it's our duty to identify them and then treat where necessary or refer. Some of them will refer to the gastroenterologist who handled the issue of hepatitis. So what we'll do this time is just what Dr. Gimba said. When we have that initial result, we contact those people and subject them to a repeat in a different lab so that we can be able to bridge that gap. Please, our health workers, we need you to be on ground tomorrow. Please come with your stethoscopes, all the things that you can use to attend to God's people. Now, if you have tables, plastic tables, and you are coming with your car, you can also help us come with them because I have interacted with church managers. We may have shortage of tables, and to set up our consultations and our lab tests, we need some of them. I will personally come with 2. So if you have 1 or 2 in your house, you can as well come with it. What we advise is immediately you are giving us anything for use, let us know. We are coming with masking tape, and we write a label of your name for the purpose of identification, so that as soon as we are done, you can be able to go with those things. I think those are the few announcements for now. Hopefully by tomorrow we'll be here by God's grace. Please, those that are coming for the test should come right on time. We'll also contact the lab scientists this evening. We'll call on our vicar, Reverend Chikura, to close us with a word of prayer. Thank you very much.
I remember one of my professors at school. His wife had an issue, and they were rushing her to the hospital, and the son was just saying, "Thank God my father is a doctor. Thank God my father is a doctor." And he turned to the son and said, "I'm a book doctor. I'm not a medical doctor." Well, thank God doctors will be assembling tomorrow. I'll have my table too. Can we rise as we pray? Father, thank you for helping us today. We are grateful for those you have used to bless us. Lots of informations have come our way. Some of it are scary. Some of them are realities for us to rise up to the occasion and do something concerning our health. We ask, Lord, that you help us, Lord. We pray especially for everyone that will be conducting tests tomorrow, that, Lord, it will be without error. Divinely, we ask, O Spirit of the Most High, that you step in. And, Lord, the things that need to be caught will be caught. And, Lord, there will be no error to the praise of your name. Bless everyone that have given themselves to serve. And we trust in you, our God, that your name will be honored even tomorrow. Thank you for answered prayer. In Jesus' name we pray. Surely, God's goodness and mercy shall follow us all the days of our lives, and we shall dwell in the house of the Lord forever and ever. Amen. God bless you.